I'm Jan Marini, the founder of Jan Marini Skin Research. Welcome. I am here with Katy. She's here for her consultation. And Katy plays volleyball.
I did, yes. I did play volleyball.
And actually, you're a volleyball coach, though.
I'm a volleyball coach currently.
Collegiate volleyball coach.
Right.
But she's played professional volleyball.
Yes.
So lots of sun exposure.
That is true, yeah.
So if there was something you could change or improve about your skin, what would it be?
I think the discoloration and the sun spots that I see on the side of my face where maybe the sunglasses did not cover. Also, yeah, just evening out the skin tone, and I still break out once in a while, so I'd like to remedy that. Of course, aging is an issue because I'm getting older and I'm seeing just fine lines, more than fine lines, and I would like to delay that process as long as I could.
Okay. So discoloration and sometimes acne breakouts, fine lines, and anything else you'd like to change or improve?
Yeah, I think I would just like to look healthy, to glow, and I don't like to wear a lot of makeup, and especially so I'd like to be more natural and not have to cover up the discoloration or whatever.
That's what we all want, right?
Yes.
Okay. So what type of skin do you think you have? Do you think it's normal, combination, oily? How would you describe it?
I would say it's normal.
Okay.
That's what most people that I've seen as estheticians, they've said, but it could be, I don't know, I would say it's normal. That's
so you really don't have any areas where you feel like you tend to get more shiny, and you really don't have any areas where you feel like you're real dry or anything like that?
Right, correct.
Okay, great. And have you ever been a smoker?
I have not.
And sunbather?
Yes. Baby oil, and in the 80s it went together.
And of course, you've had a lot of incidental sun exposure.
Yes.
With being out in playing volleyball.
Correct.
Okay. So where do you think, point to where you think you have discoloration?
So I have on the sides of my face right here. So, and on this side as well. And sometimes I'll get, I wouldn't call it rosacea, but red pigment here, like on the sides here, which might, I've been told, I went to the physician and the doctor, and she said possibly hormones.
Okay.
So that's where, I believe the sunspots, and some on my forehead as well.
Okay, forehead. And where do you, if you break out occasionally, where do you get the breakouts?
Usually around here, actually, right here.
Okay, so it's kind of the side of the chin area.
That is correct,
going into
right
the
here.
jawline.
Yes.
And when you break out, do you get papules that turn into pustules, or do you get some of those hard sort of underground?
Underground.
Okay.
Yes.
So we call those nodules or mini cysts.
Okay.
Did you have any acne as a teenager?
I didn't. I mean, it's normal, I think, teenage breakouts, but nothing severe.
Okay, maybe just very minor acne?
Minor acne.
Where do you think you have fine lines?
Around my eyes, and so specifically here.
So like the crow's feet?
Yes.
Okay. Any place else?
Well, I have bigger lines, wrinkles on my forehead, so that's something
that
bothers me.
So let's talk about what you use currently. What do you wash with in the morning?
Just a cleanser. It's nothing.
We'll call the brand.
Oh my gosh, GM Collins.
Okay. Is it a gel? Is it a lotion?
It is a gel.
Okay. So the reason I asked that question is because if it's a gel, it's typically all skin types. If it's a lotion, it's usually normal to dry. If it's a cream, it's dry skin. So it's very easy for me to tell what type of cleanser and what skin type it's for. Anything in it that's, that they pinpoint, like any salicylic acid or anything like that?
Yeah, I think it's a glycolic acid.
Okay, with glycolic acid.
And I might be wrong on that. I'm not sure.
And what do you do after you clean?
Let's see. Right now, I'm just trying to think. I put vitamin C
Okay.
on my face. And this, I think this is a Baji
Okay.
brand. And then I use a light moisturizer.
And who makes the moisturizer?
I can't remember. It was someone I didn't know. I don't know. It's not a name brand.
Okay. And
I used sunscreen after that, and that was that's a GM Collins sunscreen,
Okay.
tinted.
do you know what the SPF is?
I want to say 30.
Okay. Do you know if it's broad spectrum?
Actually, I don't know. That's a good question.
Okay. But the good news is she's using a sunscreen. Okay. And at
Same
night,
wash, yeah.
do you wash the same thing?
Same thing.
Same thing, vitamin C,
Vitamin C.
same moisturizer.
Actually, I use a night, recently, like a night moisturizer that's like a caviar night moisturizer.
Oh, by
yes.
by Chanel? No, not Chanel.
No,
La Prairie.
Yes.
And then anything that you put on after that. And by the way, the caviar night moisturizer is the one that's in like the little pump, or is it in the little capsules?
And the pump.
Okay. It's like a serum.
Mm-hmm.
Okay. Anything? What do you do after that?
No, nothing else actually.
Okay.
Yeah. Oh, and eye cream. I use eye cream,
Okay.
but I can't remember the brand. It's the same one as my moisturizer for the day.
Okay. Anything that you do occasionally, like do you do a scrub or do
I
you
do
a mask?
use a scrub once in a while. It's in my shower, and I'll use it. It's GM Collins. Is it GM Collins? I can't remember what it is, but it's something along. Yes, I use a scrub. At different times, I switch out the vitamin C, like the kind I used. I've used yours. I've also, and I've used your glycolic. Is there
Glycolic cleanser?
yeah, that and the siesta. So just different things. Yeah.
Okay. All right. Well, where do we begin? So, most of the damage that you're going to see in your lifetime happened before the age of 10. Probably at least 50% of it is programmed in the skin before the age of 20. So it's actually programmed into your DNA, and it just takes 10, 20, 30, 40 years to show up. Now, the more sun exposure you have, the more exacerbates it. But even if you weren't a sunbather, even if you didn't play volleyball, it's incidental sun exposure. It's being in your car, it's going to the park, it's going to the ball game, it's just being outside. So really what we're talking about is virtually all these things that you've identified for the most part are sun exposure.
Yes.
A couple of things that you identified that I want to initially focus on, and that has to do with the fine lines around the eye area and also the forehead. So most of the fine lines that we see, that's sun exposure. But then there's something called dynamic muscle movement. Now, dynamic muscle movement, if you lived in a cave, you never went outside, but you made expression lines. Those lines cause certain muscles, or the expressions cause certain muscles to overwork, and what it does is it makes a crease in the muscle. And when you put the skin over the crease, you've heard me say this before, when you put the skin over the crease, then you have a line there. Now, I can soften them. However, that's Botox. And I'm not suggesting people run out and get Botox. I don't sell Botox, but nevertheless,
you have
just
to relax
realistically, right. And what it does is, it in a sense, paralyzes, that's a horrible sounding word, but it paralyzes certain muscles, but it doesn't stop all the other muscles. So it's not like it paralyzes your face. What happens is that when you cause that relaxation and the muscle stops working, the crease goes away. And over time, that area can even have some atrophy, which sounds really bad, but it's a good thing because it means that you may not have to have it as often. Generally, Botox lasts anywhere from 3-4 months, something like that. So again, can help that. That's going to be forehead, parentheses between the eyebrows, crow's feet, that type of thing. But again, can do some things to kind of soften that up. So I want to also, next I want to talk a little bit about the acne. Because actually, I think you have really good skin, and one of the things that I don't see with your skin, like you don't seem to have big pores. You don't seem to have had very little acne as a teenager, and that's a big deal because acne is an epidemic today among women in their 20s, 30s, 40s, and beyond. Now, the issue for you is that when you do get it, you actually get a nodule or a cyst, and that is the most severe form of acne, even if you only get one.
Interesting.
So when people get little papules or pustules, that's a lesser form of acne. If you have clogged pores, that is the least form of acne, the one that's the least aggressive. So generally, when you have that type of acne, what it is, it's a testosterone sensitivity. As many as 90 to 95% of the women today that have acne, they actually believe that there is either you have a little bit of free testosterone or you have a testosterone sensitivity. What happens is you have certain enzymes in your follicle known as 5A reductase that are harmless. And when they get together with the testosterone sensitivity, they form dihydrotestosterone. The most aggressive form of testosterone is like instant acne. It's usually in the chin, jawline, perioral area. It can be anywhere, but it's usually that area. So many people say, I didn't really have any acne as a teenager. Why do I get it now? And why do I get these big ones? Or I had some acne, it went away. I was clear. Then all of a sudden I got in my 30s, my 40s, beyond, whatever, I have it again. So what we're going to do today should really, really make a difference. However, if it doesn't, because I think a good basic program is going to make a difference for you, but if it doesn't, then there's something in addition that we can do.
Okay.
What you have to do with any type of acne, regardless of the cause, is first of all, you have to introduce something in the follicle that keeps the cells from sticking together, because that's the basis of the acne process. You have cells that line the inside of the follicle for whatever reason, genetics, whatever, they stick together. And when they stick together, it traps P. acne bacteria, which is harmless. I have it. Virtually everyone has this, but it's harmless. But it's when it's trapped in the follicle and when oil gets trapped in there, and you don't have to have an oily skin, but it's trapped. The bacteria eats the oil, and then it excretes a byproduct that's a very toxic fatty acid byproduct. And what that byproduct does is it eventually wears your follicle walls down. So if you had a leak at the top of your follicle, you'd get a little papule that turns into a pustule. If you have an actual break or a rupture in the follicle, that's when you get the nodule or the mini cyst. And if your whole side of your follicle blew up, you'd have a really deep cyst. Now, the reason that I don't think you have really deep cysts is because nodules can produce scars, not always, but cysts always produce scars because they're so deep that they destroy collagen. So it's an inflammatory disorder. And again, I think that what we're going to do is to be able to address that, because what you have to do is you have to introduce something that keeps the cells from sticking together. And that's kind of the beginning of it. For some people, when it's not a constant issue, that's enough. And that same type of topical that we do for that is what resurfaces the skin. And it makes the skin just look brighter. It makes it look smoother. It addresses the appearance of fine lines. It just gives you that, you're talking about that glow. You get the glow. Yep, you get the glow. The other thing that is an issue for you is the discoloration. Now, the discoloration is something that it gets worse over time.
With aging.
Well, and primarily sun exposure, but it's really more probably sun exposure. And then there's another issue. So we all have a hormone that floats around in our body, and we pretty much have the same amount, whether you have dark skin, whether you're a redhead that always burns and never tans. And it's a genetic component that influences how you react to the environment. So there's some people who've been in the sun as much as you have, and they'd have big brown patches. Now, you have more of it when you're pregnant, more of it when you're on birth control pills. I don't know if you had more of an issue when you're pregnant.
I never did, but I had friends, yes.
Okay, so, melasma, that type of thing. So, but how you react to the environment, and whether or not, some people pigment sitting in a hot car, and other people, I have issues with my skin, but pigmentation is not always one of them. So it just depends on a lot of your genetics. What typically we do for pigmentation, traditionally, is you use something called tyrosinase inhibitors. Tyrosinase inhibitors are what interacts with active tyrosinase in the epidermis, and it helps to lessen the appearance of the pigment, the way that the pigment is thrown off, those kinds of things.
Mm-hmm.
And there's some tyrosinase inhibitors that are very weak and others that are stronger. But the one area that hasn't been addressed before has to do with this hormone. And we have a way of dealing with that today. So it can make a huge difference. And that's one of the things that I think is going to be sort of a cornerstone in your program. Because also something that we have in this product for lightening, this is our Luminant face lotion. Something that we have in there is turmeric. And turmeric has been used for centuries in India. Now we have tyrosinase inhibitors. We've got something that, has to do with that hormone. And we have turmeric. And turmeric has been used for centuries in India. Women would put it on their skin even just a few days before an event, and they could get lightening. It's very strong. It's an extremely strong tyrosinase inhibitor, but during the time you're wearing it, you look bright yellow. So, anyway. And through the years, companies have used things like turmeric extract and turmeric root, and it's very, very mild, and it doesn't really have the aggressive effect that the full extract has. And so for the first time, we've been able to take this and make it colorless. And it really helps also, just to brighten the skin, but a tremendous effect on the appearance of pigment. And I think it also has a nice anti-aging effect. And it's just helpful all the way around. So what we're going to recommend for you is the basic skincare management system. Okay. Now the basic skincare management system really focuses on resurfacing, but also some anti-aging ingredients and anti-inflammatories. Resurfacing is a term that I use that addresses superficial imperfections. So whether it's mild to moderate acne, whether it is a rosacea, whether it's discoloration, whether it's large pores, people want their skin to glow, all of those things. And the idea with resurfacing is that it gives that skin, for want of a better description, the red carpet glow. I always envy the celebrities walking down the red carpet because they look like they're not really wearing makeup, but their skin just glows. So it's that kind of look even when you're not wearing makeup, because it just perfects everything. Texture, all of those issues. And there's quite a number of anti-aging types of products and things in there for the appearance of kind of what you've talked about, and texture and fine lines and all of that. Lipid-soluble vitamin C, something called Transformation, which I refer to as TGF-beta1, which has transferrin growth factor beta-1. Dr. Weedo of Jefferson University established that it stimulates the type of collagen you don't produce after the age of 30. There's a bunch of different things in there like that. Now, in addition to that, you're going to be using the Luminant. And then there's one other thing that I'm going to recommend for you. And by the way, the skincare management system is going to be normal combo. Now, when I was asking Katy about the products that she uses, it's not so much that I really necessarily care what she uses. It's that it gives me an idea, first of all, how much time did she spend on her skin, but also when somebody says their skin is normal or they tend to say it's dry, sometimes it's because maybe they're not using enough things to hydrate the skin, or if they're really oily, sometimes they're overdoing certain things. So it just gives me an idea. But I think the normal combo system is going to be perfect for you. And so normal combo, going to have you use, and by the way, this system, the skincare management system, if I can brag for a second, New Beauty, this is the magazine you see back here. New Beauty is a premier aesthetic magazine. I don't know if you've ever read it or not. It only comes out like 4 times a year, but it is just packed full. It's like the industry Bible in terms of aesthetic procedures and products and all of that. And they they have awards every year. And for 8 years in a row, we've been named the best system in a doctor's office.
Congratulations.
Thank you. So that's a system you're going to be on. I'm also going to have you on the Luminant. And then in addition to that, I'm going to have you using something called Cleanzyme and Skinzyme. So Cleanzyme and Skinzyme is a proteolytic enzyme. It's actually green papaya. Green papaya is about 50 to 100 times stronger than ripe papaya. And it has the ability to digest dead and diseased tissue, but it can't hurt normal living tissue. So when you use a scrub, even if it's very fine granules, you can actually create microscopic tears in the skin and you create inflammation. Inflammation can exacerbate acne. Inflammation can exacerbate hyperpigmentation. Aging is inflammation. So that doesn't know the difference between your living skin and your dead skin. This can only go after dead or diseased tissue. And as a matter of fact, we have lots of physicians who even use this on patients' skin shortly after Fraxel or laser resurfacing, because it can only go after the skin that's kind of dry and peely. And when you use this product, when you get done using it, your skin looks like glass afterwards. I literally use it every single night, but you can use it once a week, twice a week, on an occasional basis, whatever you want to do to supplement your program. Good for any skin type, it's just one of my favorite products. I'm also going to have you use the Luminate Eye Gel.
Okay.
And I'm thinking. I didn't go away, I'm thinking. Luminate Eye Gel is literally my favorite eye product. And I'm just looking to see where it is here. Here it is. So this was actually something that was made for dark circles. But it is so remarkable under and around the eye area for anybody. Because as we age, even if you don't specifically have dark circles, that skin gets thinner and it shows the vascular structure more. It just doesn't look it looks more fragile. And so it makes a big difference with that. And it also has retinol. It makes a big difference on the appearance of fine lines. Again, it's one of my favorite products. And the consistency of it is the consistency of a primer. And one of the reasons why you use primers on your face or you use them around the eye area is because if you do ever use some type of a product like a cover up underneath the eyes or a highlight or something like that, it keeps it from sinking into the lines. And so it optically has a nice effect around the eye area as well. And again, when you don't wear makeup, like I don't wear foundation. So it's rare that I ever wear foundation. And so those kinds of things for me are important to keep that eye area looking nice and bright. Okay. And then one other thing that I'm going to recommend for your program is Hyla 3D. This is Hyla 3D. So I'm not going to go into a huge amount of detail because I don't want to take up too much time, but one of the biggest issues in aging is loss of volume. So when hyaluronic acid is critical to volume. In fact, the common denominator in aging between all species, even if an insect, is loss of connective tissue, because connective tissue makes you fluffy. So as you age, you literally shrink. And I know we've all said, we've referred to older people as little old people because everybody shrinks. And connective tissue, one of its main components is hyaluronic acid. So when the face is volumized, the highest point of the face is the cheekbones. It's known as a youthful triangle. So they're high. This is the widest point. It narrows down into a defined jawline. When we age and lose volume, what happens is the cheek pad moves down. You start to see a nasolabial fold. You can see more drooping at the corners of the mouth. And eventually, the widest part of the face becomes the jawline. And this is narrower than the jawline. And as a result, female faces become masculinized in facial appearance as they age. When men become more masculinized, which they do, well, we look at that as a good thing.
Right.
we can't, they look rugged, they look great.
Right.
But one of the reasons why people oftentimes say that if you live together long enough, you start looking like each other, it's because females become more masculinized. So volume is huge. This is why injectables are such a big deal.
Right.
People can have facelifts, but their face looks skeletal. And so an injectable typically is hyaluronic acid. And believe it or not, the hyaluronic acid is not what makes the correction. Hyaluronic acid becomes a framework for collagen to form around it. How long the collagen lasts and how long the correction lasts has to do with, number one, how much movement do you have?
Mhm.
And two, how cross-linked it is, because the more cross-linked the hyaluronic acid is, the longer it lasts. But you can't have it really cross-linked in areas where you have a lot of movement. So for example, they'll put it in the cheek area. Voluma is a good example, and it might last somebody a year or 2 years. Not very much movement. So anyway, make a long story short, Hyla 3D is hyaluronic acid, but it is a game changer because there's hyaluronic acid is in everything. I put it in products for years. And it's a large molecule, sits on the surface of the skin. It does have the ability to actually add moisture to the skin, but it's very, very short-lived. This is tiny little molecules that can penetrate. And this is really exciting technology. Yeah. And so these molecules can actually provide a framework. And over time, your skin just looks softer. It just looks plumper. It looks smoother. And actually, these molecules have a much, much, much longer action than any of the superficial molecules. And there's some other things in there that are very, very helpful to make the skin, again, look, more volumized, look plumper, fuller. So I'm putting that in there as well.
Thank you.
Okay?
Yes.
And I think that just about does it. Do you have any questions for me?
No. It's very impressive, so thank you so much.
Thank you. Are you excited?
Yes, I'm very excited.
Great.
So, yes.
Well, I'll be excited to check back with Katy and see how she's doing and kind of what she sees with her skin. So with that said, we're going to go away for now. And please, 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 please subscribe. Thank you so much. Bye.
Thank you.